The best thing to me about cardiology, in particular interventional cardiology, is the way that you have an immediate impact on an illness. That if someone's presenting with a heart attack, they have a blocked artery, and you know what to do. And when you do that, the person immediately begins to feel better. You take someone who's feeling horrible and possibly dying to feeling great and living in many more years. In the health system as a whole, I've been very impressed with everything from the outpatient services to the inpatient services. We have excellent family practitioners. We have excellent general internists in the outpatient setting. My interactions with them, I always find them to be very thoughtful, very appropriate, very caring, very competent. Our nursing staff is outstanding, and they're outstanding for the same reasons that for the same reasons that make a doctor good. I think what patients need is to feel that they have a relationship with their doctor, with their nurses, and I think that that's probably easier at a small community hospital. Is ability to feel that you have a relationship. When I go to if I go out to eat, I might run into my patients. If I go out to the grocery store, I might run into my patients. And I think in bigger centers, they're usually in bigger cities, and I just think there's less of in my opinion, a relationship with that a patient can get by going to a smaller hospital. You kind of start thinking about your patients, and the floodgates open. I can remember everything about my patients. We have a small community hospital that has the latest technology, the latest expertise, but on top of that, there's a feeling of home to it. There's a patient that I had seen in clinic who was that was clearly at risk for heart attack, and it wasn't too long after I'd seen him that I got a phone call during the evening, and he was having chest pain, and it was absolutely a red flag problem. And so he was transferred to an outside hospital and then transferred to us, and was clearly having a heart attack, and there are heart attacks and there are heart attacks, and this was a big heart attack, and this was the type of one that he wasn't going to survive. And in fact, before he arrived, he had actually had a cardiac arrest. Being able to assist with someone who's having a medical emergency, in the form of a heart attack, and really saving their life. I mean, people come in to the emergency room, they're dying, and we open up the artery, and now they're not dying. And I can't think of a better service that I can do for someone and for the family of the person.